Hello, everyone. This is WWE Superstar Drew McIntyre. Today, I'm thrilled to be joined for a special conversation about the COVID-19 vaccines by Dr. Francis Collins, the Director of the National Institutes of Health. With COVID-19 vaccines available to every American over 16, and the recent news that the Pfizer vaccine is now available to adolescents aged 12 to 15, I wanted to take time with an expert like Dr. Collins to answer some common questions we might all be having about the vaccines. So Dr. Collins, I'll turn it over to you.
Well, thank you. It is an honor indeed to appear with Superstar like you, Drew, for WWE, and to have a chance to have this conversation about where we are with COVID-19 and particularly about how we're going to get past this, because I know everybody is anxious to get back to something approaching normal life. And I'm sure in your experience, having to have competitions without a crowd that's live there in the arena is something you'll be very glad to put behind you. So I'm glad to be with you and see what questions you might be able to convey that you're hearing from people who are WWE fans, because I'm going to try to make the case that the best way for us to get past this is to get as many of us as possible immunized, and then the virus loses the WrestleMania that's happening right now between the virus and the country, and we can go on with life the way that we always hoped we could. But we're not going to get there unless we get enough of us immunized, because otherwise the virus will continue to have its own version of a party at our expense.
Absolutely. Well, let's get right into it, Doctor, if you don't mind. Right. Well, a lot of Americans right now are still, hesitant and skeptical about getting vaccinated, and they're asking, why should we get vaccinated at all?
And I understand people have questions, and it's appropriate to have those questions. And by the way, if you're one of those folks and you would like to get a better sense of answers to those questions and find out who it is who's out there supporting this, not just people from the government like me, go to Google and just type in very simple 4 words: "We can do this." And that will take you to the site for the COVID Community Core, which is hundreds of organizations, all of them recognizing that our best hope for putting this behind us and getting over what has been a horrible pandemic that's taken almost 600,000 lives is going to be vaccinations, getting enough of us immune. And there's a lot of ways in which at that site you can get your questions answered, because there's a lot of material there that you can trust. And let's be clear, there's a lot of stuff out there in social media that probably isn't based on evidence. A lot of conspiracies, a lot of things that probably are scaring people about the vaccines, but are simply not true. For me, I'm the guy who runs the National Institutes of Health. That is the overarching way in which our country, the United States of America, supports medical research. So I've been 100-hour-a-week devoted to this for the last 16 months. And I can tell you the vaccines were tested in the most rigorous way that we've ever tested a vaccine. At least 30,000 people for the Moderna vaccine, the Pfizer vaccine, the J&J vaccine, to see whether they really were effective and whether they were safe. And only after that data was in hand and looked at in a public meeting, but anybody could look at it, was the conclusion made that, yes, this is something you would want. In fact, it's better than I think I dared to hope. Effectiveness, 95% of protecting you against this disease, and with a very, very good safety record.
We hear about the spreading variants of the virus, and how effective will the vaccines be against these variants, and how long will the vaccines keep us protected?
That's a very good question, Drew. We are seeing these variants emerge. This virus has been so successful in infecting so many people that even an occasional random change in the virus, if it happens to make it a little bit more contagious, then that particular viral variant starts to dominate. And we've seen that happen right now in the United States. A variant that originally swept through the United Kingdom is now sweeping through the US. More than half of the viruses that we look at now are that very strain called B.1.1.7. And that one, happily, while it's more contagious, and that's why it's been so successful, it responds very well to our vaccines. So you're well protected against that if you get fully vaccinated. There are others in Brazil, South Africa, India. We are watching those day by day and immediately checking them out to see if they might evade the vaccine protection. So far, so good. The vaccines right now look as if they cover all of these. But again, I don't know what's lurking out there as far as some future variant. The best way to protect against that is to make sure this virus doesn't have the chance to keep infecting people and developing new ways of spelling its instruction book, which means if we can all get vaccinated and tamp that down, we could see the end of the variants. And we're on a good path here, Drew. You could see in the course of the last couple of months, after a really tough time in January and February, the number of cases continues to drop. The number of deaths still too high, a few hundred a day, but it's on the way down. If we could drive that all the way down to single digits, then I think we might be able to say we can really start opening up and stop being so fearful. And yet, I know some people are also wondering, well, what about me? I had COVID already. Why are you talking about vaccines? That would be you, wouldn't it, Drew? I heard you got sick with this. Tell me about that. What was that experience like?
Well, I mean, I think in the grand scheme of things, I was fortunate with the symptoms. I had a fever one night. I was run down for a few days, lost my sense of smell and taste. Obviously, with everything happening to people across the world, I got lucky, and it was very fortunate that WWE allowed me to talk about my experience on our flagship show, Monday Night Raw, and just tell the truth that I've been following all the CDC guidelines, wearing my mask, socially distancing. I have a gym in my garage downstairs. My wife and I are hermits, essentially. Our food's delivered to the house, and I still caught it. And I wanted to tell everyone, if I follow everything to the letter and I can still catch it, so can you. And I'm very excited to say also, I'm out with my 90 days now since I had COVID. My wife and I are getting vaccinated tomorrow with shot number 1.
That is great. Well, Drew, thank you for being so public about this, because not everybody has been willing to do so. And if somebody in your kind of physical condition with the care that you were taking can still get infected with this virus, it could happen to anybody. So people who are listening, if you think you're the one who's going to be off the radar for this virus, apparently the radar is going to find you, and all the more
100%.
reason to get the vaccines. Now, you said you're going to get vaccinated anyway. That's really important. People have wondered about that. If you already had the disease, don't you have immunity from it? And the answer is, yeah, you have some immunity, but the vaccine gives you a heck of a lot more. So everybody who gets COVID-19 should still sign up, get the vaccine. Hey, it's free. By the way, I should mention, if you can't figure out where to go to get a dose, go to vaccines.gov. That will tell you, or go to your cell phone and just punch in 438-829. That happens to be Get Vax if you're looking at the letters on your phone. So 438-829, and then type in your zip code, and within less than a minute, you will get 3 locations near you that have vaccines in stock with a phone number, so you can call them and set it up. It's no longer going to be hard to get vaccinated. I know it was for a while when there was such a demand, but now we got a lot of supply.
That's excellent. Yeah, I can't encourage people enough. Once you're eligible, get vaccinated. It's really the only way we're going to start getting back to normal. Number one priority is obviously health and safety and saving lives, but I'm sure everyone out there misses, human contact. I miss seeing my family back in Scotland. Everyone in America, I'm sure, misses seeing their family and friends in person and attending live events. So when you're eligible, please get vaccinated. But let's keep diving down into these questions here to see if we can answer some of people's minds. I guess something people probably keep hearing and they perhaps don't understand, and maybe if there's a short way to break it down and put it in layman's terms, what exactly is an mRNA?
Well, it's a way of making a vaccine that happens to be really efficient and turns out to be really safe and really effective. M stands for messenger, and RNA is basically that. It's the message that goes from the DNA, which you could think of as your instruction book, or it can be the instruction book of a virus, and the protein, which is sort of what does the work of the cell or of the virus. And in the past, we've generally made vaccines either by killing the virus so that it's no longer infectious, or you would make some protein part of it that you could use to immunize. But RNA is really good at coding for that protein. And the value of having that as an approach turns out to be that you can immediately start designing your vaccine as soon as somebody puts up on the internet the actual letters of the code of this virus, which is what happened back on January 10th of 2020. And over a weekend, our scientists at NIH designed the vaccine, and 63 days later, the first person was getting immunized in an early trial. That's like 10 times faster than it would normally be possible to do. It's a new way. I think in the future, a lot of vaccines will depend on mRNA because it turned out to work so well for COVID.
I heard a fellow doctor describe it almost as a little wanted poster, like inside your body. Like if the virus was to get inside your body, your DNA, I guess, would recognize the COVID and be able to attack it. So viruses are quite frankly terrifying in the sense that they can go in your body, hide themselves and replicate within you. And they're the most terrifying things, as far as I'm concerned, in the world. And that little wanted poster lets your body know, no, this is one of the bad guys, let's attack.
That's right. You're in the top 10. We're going to go after you because we recognize you from that poster. That's a good analogy. Your immune system is this amazing biotechnology factory, by the way, that you have built in. And so it sees that mRNA that's code for that protein. It's not going to make you sick. It's not the virus, but it's a way for your immune system to get primed. And if the virus comes along, bam, you've got it in a matter of a couple of days, as opposed to if you've never seen it before, your antibodies are kind of slow. You may be in the ICU before they kick in, and by then the virus is won. So it's an amazing system. It works really well, and it turns out to be really safe.
It's incredible. So doctor, when do you think we'll be able to move into the new normal as long as more and more people do get vaccinated?
So Drew, it's already providing benefit. My wife and I are now fully vaccinated. As of about 3 weeks ago, we went through 2 doses and then 2 weeks after the second dose, and that's when your antibody levels are up there. So we were able to invite another couple to come to our house and have dinner together because they were immunized as well. We took off our masks. We broke bread together around our table. We hugged each other at the end of the evening. It was so wonderful after such a long year of not being able to do any of that. People should recognize already when you get vaccinated, there's a liberation. You get to do stuff that previously you didn't feel was quite safe, and now it is. Of course, we want to see that go forward. And as we get more and more of the country immunized and less of the virus circulating, I mean, Drew, you've had to go through the experience of having what should have been people screening and on their feet. And instead, there's nobody there except a lot of screens and you and your opponent. I imagine that was pretty weird, and you must be really looking forward to the time when people come back and you can have that crowd support that must be so important to the experience of being a superstar like you.
Oh, 100%. Our fans are the most important aspect of our product. We've always said that our WWE Universe, as we call our fans, are our #1 superstar, our secret sauce. They create the unique atmosphere that you expect from WWE. And I've been to every sporting event in the world, and I can only equate our passionate fans to European soccer fans with how loud they get. So we said that all along, and we knew it, but we didn't truly see how much they meant to us until we just didn't have them. And like at the height of the pandemic, we brought the World WrestleMania with only original content in town, trying to give everybody an escape through the WWE television shows. And the crowd weren't there. We brought our shows inside a warehouse, essentially with no live fans. We had to innovate and adapt and find new ways to connect with our fans at home. And I'm sure everybody out there, businesses across the world, were having to find new ways to do business. And we were exactly the same. Eventually, we pivoted into our WWE Thunderdome, which brought our fans in virtually. It was nice to hear them over the speakers. For people at home, we're back in arenas. You've got the lights, lasers, pyro, everything you expect from WWE, more palatable for the viewer. But nothing's like the live fans. WrestleMania 37 just passed. We had a limited capacity, 25,000 fans. And all you have to do is watch the first match, the first entrance. It was myself walking to the ring. It had been 1 year, 1 month, and 1 day since we had fans live in attendance. And you can see by my face, I'm almost breaking down in tears. That's how much it meant to me, how emotional I was. And if you look at the fans in the crowd, they're exactly the same, the emotion across their face. And let's keep getting vaccinated, people. Come on, let's get back to normal. And I cannot wait to have those live fans back in attendance every single week.
That is so well said. And this really is a moment where it's up to all of us who've not yet taken advantage of this. If you're worried about the safety issues, those questions are appropriate, but they are really good answers out there. And again, as I said earlier, this is also a love your neighbor moment where it is not just about protecting yourself, although that's really important. It's also providing us with enough people in every community who are immunized that the virus basically loses out in its effort to keep going. And we can all contribute to that, but only if we roll up our sleeves and join the group that are immune.
Is a vaccine safe for pregnant women?
That's a great question. And people have worried, women who are in childbearing years. We have very good data now because there have been so many people who have been immunized, 150 million people in the US, and many of them are women in childbearing age. First of all, there is no evidence that this has any impact on fertility. There was concerns about that and some rumors about that. It does not seem to be the case. And as far as pregnancy, also, we've had lots of women now who have had their babies who got immunized during the pregnancy. And that was just published about a week ago. There is no hint there of any cause of trouble that the vaccines have caused. There is something, though, to notice, and that is if you're pregnant and you get COVID-19 because you weren't vaccinated, your chance of getting pretty sick is significantly more than somebody who's not pregnant. And there are certainly women who have ended up in a very bad place in the ICU, and even a few women who've died in the later stages of pregnancy from COVID-19 because it doesn't do well in a late stage of pregnancy. So if you had to balance the risks here, it sounds as if vaccination for pregnant women is probably more of a benefit than a possible risk. But women ought to talk to their own doctor and get that information and make a decision. But there's certainly no contraindication at this point.
Awesome. And I guess another big one we hear about, in the news, etc., is certain, I guess, races are worried it might affect them more. And I was wondering if you could speak on that and perhaps alleviate some concerns for everybody.
Indeed. I mean, one of the heartbreaking things about this disease is how it has hit communities even harder who already had more health concerns. So African Americans, Native Americans, Latinos have had a higher level of hospitalization, a higher level of death from COVID-19 than whites have. And a lot of that is because these are groups that have limited access to medical care and also a higher level of health disparities, things like hypertension and diabetes, which we know increase your risk of having a severe case of COVID-19. So you want to know then, do the vaccines work just as well for these groups? I personally spent a lot of my time over the course of the last 9 months making sure that the vaccine trials enrolled people from all of those groups. The Moderna vaccine trial, for instance, 37% of the participants in that trial were people of color. So you can look at the results and say, this isn't just about young, healthy white people. This is about our country. And you can look at those subgroups and see they all had this remarkable benefit of 95% effectiveness and a very good safety record.
So I'm hearing a common theme throughout our chat here is, don't just believe everything people tell you on the streets, what you read on the clickbait. Take the time, look at the actual facts, the scientific facts from experts like yourself. If you just take the time to look at the facts, I think that would help people dramatically right now.
It would, Drew. And, some people, I think reasonably were like, this seems like it's just come out. I'm going to wait and see. At this point, the waiting and seeing has kind of happened. There are now people walking around who were part of those trials almost a year ago, and they're fine. So if there was a concern about there being some slow, delayed, unanticipated adverse event, it has not happened. So if you're one of those right now saying, well, let's wait and see, I think it's time to stop waiting because I think the evidence is in that this has turned out to be our best protection and our best hope for ending this terrible pandemic.
Absolutely. Well, Dr. Collins, I feel very fortunate that I even got a little bit of time with you today. I'm hoping we've answered a lot of people's personal questions that have been on their mind. I know you've answered a lot of mine. I can't thank you enough for your valuable time. I'm just wondering, is there any last messages you'd like to share with everybody before we wrap up today?
Well, thanks for the chance to have this conversation. And Drew, thank you for being out there trying to share this scientific evidence so that people can make up their minds. I do want to say, I think sometimes the medical profession and maybe even people like me have come across as like shaking their finger at people and saying, you should just go do this because I said so. That isn't the right answer either. People do have legitimate questions. Our conversation today, I hope, has helped to answer some of those. Talk to your doctor if you're not quite sure. By the way, more than 90% of doctors have gotten vaccinated. That tells you what they think about the value of this. But if we could kind of calm down a lot of the rhetoric, a lot of the conspiracies that are out there in social media, separate this out from politics, which somehow got in there too, which probably hasn't been very helpful, and recognize this for what it is. This is a scientific moment of opportunity to save lives. This is a gift that we've somehow been able to put forward through the tools of science. And why would we not want to unwrap the gift? And that means roll up your sleeve.
Absolutely. Well, we're so lucky we live in the times we live in, and we have the medical professionals we have today. And what it comes down to is simply just look at the facts, everybody. And thank you again for your time, Doctor. For more information on the COVID-19 vaccines, to find a vaccine site near you, please visit getvaccineanswers.org. Once again, thank you so much for your time, Doctor.
Thanks, Drew. Great to talk to you.
You too.